Keller with the Center for Health Design. The Center for Health Design is located at about an hour north of here in Concord, California. We have offices all throughout the United States as well as in India. We're a research, education, advocacy nonprofit organization that predominantly looks at how the built environment in the healthcare setting is affecting patient, staff, and organizational outcomes. So today I wanted to talk to you a little bit about the research work we're doing with our Pebble projects. So if you envision a pebble being tossed into a pond and it creates a ripple effect, these are organizations that have committed to using an evidence-based design process, and they've also committed to sharing their findings with how the built environment is affecting these outcomes. We have 75 different members through 4 different countries. Typically they're healthcare systems or healthcare facilities. We have a few corporate members. We also have a few ambulatory care clinics as well. So we have the Netherlands, Canada, and the UK and the United States. I wanted to share with you some of the features, the design features that have been implemented in their facilities, but also more importantly, what they've committed to studying. So all of our Pebble projects are looking at employing different acoustic environment strategies. So what about the ceiling tiles that are going to be changing the way noise is creating the environment within their space, or how the carpet is affecting that solution. They're also looking at the layout of exam rooms or patient rooms from a seam-handedness layout or a standardization. They're also incorporating a lot of other innovative features, including aesthetic value, the surfaces and finishes to reduce falls, as well as considering the materials that reduce infections and so on. So 36% of our Pebbles are studying how a healing environment is contributing to patient, staff, and organizational outcomes, while 33% of our Pebbles are looking at the combination of same-handedness and decentralized nursing stations. Some of the outcomes that they're studying: improving patient satisfaction and improving staff satisfaction is pretty much the easiest thing to collect for our Pebbles because it's a current collecting method. Some Press-Ganey measurements or staff engagement measurements are being collected. But the ones that we're really interested at the Center for Health Design are the ones that are not necessarily being collected as aggressively. So we're looking at how the return on investment is being measured, how reduction of the length of stay, reducing adverse events, reducing patient falls, and what are the tools and the measurements that are needed to be created from the Center for Health Design's perspective to actually push those numbers a little bit further down the path. So how can we create more tools and resources for these Pebbles to collect? I wanted to just highlight a couple of examples. So on an earlier slide, I showed you that the healing environment is one of the most frequently collected items, and pretty much patient satisfaction and other measures in part of that healing environment is something that's being collected. Well, 2 projects looked at developing a POE. The first one is the Children's Hospital in Aurora, Colorado. This was designed by ZGF Architects, and it opened in 2008. It's a 300-bed hospital. It was about $450 million to build. And they are currently opening a new patient tower on the same campus in 2011. So the work that they did here just over the last year in looking at what the 2008 project really afforded in terms of aesthetic value, patient and family satisfaction, as well as any of the architectural features that they investigated, was really the method to kind of shape where they were going for this 2011 patient bed tower. The other project that I'm going to highlight with looking at the same thing, exploring the healing environment, was Trillium Health Center in Ontario, Canada. This was a 7-story patient care tower, and it opened in 2009. It had 135 beds, but what was unique about this project was that it was the first in Canada to actually implement 50% of single patient bedrooms. So they wanted to see what kind of impact that actually had with their facility. So the first one, the Children's Hospital in Denver, they had a lot of design changes from their current environment to their new environment. Some of the design changes included light, noise, and temperature, and as well as the amenities. So the existing hospital pretty much had the bare minimums. Their staff was all excited to go to the new space. The family was excited and et cetera, because the noise would be reduced, the light would be immense, they would have so many new features and so on. Some of the specific aims that they wanted to measure included family and staff satisfaction with the light, the noise, and temperature, as well as they wanted to assess the family use of the overnight facilities. So they invested a lot of money to create new amenities within their hospital environment to afford family to spend more time in the hospital. So they wanted to see if that actually had some sort of results. What they found, and these are just preliminary results, they actually just got accepted to the Health Environments Research Design Journal for publication, so I was limited to give you all of the great data that came out from it, but I would encourage you to go to that journal in in November when it's published to see the full report. But just to highlight a few things, they measured family importance from the amenities that they were including in the new hospital before they actually moved, and what would actually be important from a family perspective in terms of incorporating the new hospitals. And those items included furniture, temperature controls, minimum noise, natural light, privacy, security, and so on. So their post-occupancy evaluation revealed that they exceeded all of the family important values when they opened 6 months afterwards. They also did a staff satisfaction assessment, and they wanted to see in terms of the programmed areas where was an issue or a gap. So they assessed the charting areas, the patient rooms, the layouts of the actual spaces, the placements where they place sinks, storage, writing surfaces, and so on. And in 6 months after post-move, of course, satisfied staff all occurred in every single environment. But what doesn't tell you on these charts, but what I can tell you not on a chart because it's being published, is that some of the areas that did not necessarily receive high marks was the lighting measures. So they did some acoustic measurements as well as lighting measurements. And the lighting in their new hospital is extremely bright, being Colorado with 300 days of sunshine. They thought they needed to have floor-to-ceiling windows. And what now is happening is that children are being given sunglasses to actually, because they can't see because the glare is so bright. And so they've had to mitigate a lot of the solutions that they thought were going to be positive. So that's highlighted within their post-occupancy evaluation report. And it's also a solution that has been translated to their new hospital bed tower that's being opened in 2011. The next hospital, Trillium Health Center in Ontario. This existing hospital was a long, narrow corridor, and they wanted to see what would happen if they arranged their bed tower into 12 bed clusters to make it more of a neighborhood feel. As I said earlier, they were the first hospital in Canada to actually have 50% single patient rooms, so this was a huge bonus for this hospital. The Ministry of Health there was extremely excited about this project, and they were committed to seeing whether or not that was something that worked and if it could be translated to other hospitals within their system. They also wanted to see what happened if they actually incorporated decentralized nursing model. They also wanted to see what their infection rates did if they incorporated hand washing sinks at the point of entry in every patient room. So they had a lot of different measures that they wanted to investigate. This was a 3-part study, a multi-phase study. I'm only going to highlight the first phase. This work has been published in a journal, one of the journals in Canada, and I will have to look at the list of what it was. And then it was the entire complete post-occupancy evaluation was studied and written up in the Health Environments Research Design Journal in April of this past year. So just a few tidbits of what was found was in terms of recording average response time for calls, so how fast is the nurse responding to a patient call time. In the old layout, where it was a long, narrow layout, and it was a centralized nursing model, it took 11 minutes on average to respond to that patient call time. In the new layout, where it was 12 bed clusters and the decentralized nursing stations, it took 3.8 minutes. So you can see the time factor is a huge one. So the nurses are actually responding to the patients quite more aggressively, or they're actually hearing the page a little bit more based on the visibility and the proximity to the patient. Other interesting tidbits that came out of this work was the ergonomic solutions that they investigated from the existing environment to the new, they realized that many of their nurses kept on crawling around to actually plug in things, find data outlets or ports, and they spent a lot of time on their knees, unfortunately. And so what they found in the new hospital, because of the ergonomic solutions that were addressed in the design, the placement of thoughtful countertops and so on, is that the frequency of crawling, which was a measurement for them, was extremely low. So they were excited about that the nurses didn't have to crawl anymore. So what does this all mean for the future of healthcare and kind of where is this leading to? It's really just beginning to create the dialogue or the discussion about the importance of research and how it's actually contributing to the design of new buildings. These Pebble projects have been committed to sharing their findings, being transparent with the industry at large. So this is something that I would encourage you to tap on your peers and dig around for other Pebble projects that are doing some great research around the built environment. So that's just a very quick highlight.